Well, part two of our interview with David Ashford, the Minister for Health and Social Care, doing your question and answers. And we finished on one about vaccine passports. And this really picks up on that. So it may be already answered particularly, but Royal Caribbean are starting cruises, but have to have a vaccination certificate. I've had my first jab and I have a tatty card. Do you know what plans the Isle of Man government will provide for a substantive certificate so Manx residents can travel, I presume, on things like that? Have proof?
Yeah. First thing, the card is simply to show that you've been vaccinated. That shouldn't be used necessarily as a proof certificate. If someone requires some written proof that they have had the vaccine for any form of travel, if they get in touch with the department, we will look to try and provide that for them.
This one is about people in hospital and data, which I know where you're going to say straight away, but isn't it not useful for people to know if the people in hospital have been vaccinated or not, to give us more indication of what's going on?
We don't have that data. I'm not allowed access to that data. The vaccination data sits on the person's primary care record, and that can't be accessed without that person's permission. If the person's willing to tell us, then we know. But if the person's not, then we don't have that data.
We touched on this one earlier, so you may not want to add any more.
Sorry, just before you move on, Paul.
Oh, sorry.
The other important thing I think to add to that is also that at the moment it wouldn't tell us much anyway, because the efficacy of the vaccine builds over time. So we know from various studies that the efficacy of the first dose potentially is a 12-week build-up. So having that information now, while it might be useful in the future, it's not necessarily useful now, because you could well have someone who is vaccinated but is only building a low efficacy at the moment because they've not long been vaccinated. People have to remember this vaccine is not instant protection. It's not a case of you're jabbed in the arm and that's it, you're safe. The efficacy builds up over time. So it won't necessarily at the moment give us the information that perhaps those people are longing for.
Okay. I don't know if you've got anything to add to this, but will the Isle of Man government be removing the requirement for those who are fully vaccinated to isolate on their return?
Again, not at the moment, because like I say, the vaccine does not stop people contracting COVID. And as I say, although it's exceptionally good at reducing transmission, it doesn't remove transmission. We do have to move to a position, and Chief Minister said this many times, of us living with the virus, and that's why we have our exit strategy, that we'll be slowly doing that over a period of time, taking into account the situation in the world around us. We have to remember the island is part of a global community, so it's not just what happens here on Ireland. We have to bear in mind what's happening around the world.
Our next person who wrote in about endoscopy procedures and saying that the waiting lists are now 300 plus with just one doctor. What are you going to do about this? And it's not the only area of massive amount of waiting lists now, is there?
Yeah, so we are putting additional resource into endoscopy to try and bring the endoscopy down. Endoscopy as a diagnostic tool is exceptional. I'm not aware of there only being one doctor, as far as I'm aware, because we're actually operating 2 endoscopy rooms. So I'm not quite sure how you do that with one. But we have expanded the capacity within endoscopy already, and in fact the capacity, I believe, will actually reduce the waiting list down. We will look at what other measures we need to do as well, because it's an exceptionally important diagnostic tool, and then feeds obviously into other treatments. So if there's a backlog in endoscopy, it's preventing people then being referred on. So we are looking at what we can do to try and bring that down.
Do you have any update on that last unexplained case, which is causing some concern? Has genomics testing been completed? And in that case, did it originate from an off-island source? If the person was out and about in the community, it could turn out to be not therefore linked with the steam packet cluster and could be of great concern.
Right. Well, it definitely has been on Ireland, because the person has not left the island, is my understanding. Again, I've got to be very careful, because we're talking about one particular case here. And I think it was put across, I think it was the Director of Public Health mentioned that when we talk about an unknown case, it means we cannot be absolutely definitive. It doesn't mean we don't have ideas as to where it may have come from. And there may be, around that person, certain things that have happened that might tie it back, but it's the fact we don't have a definitive link. Unless we are absolutely definitive, it goes down as unknown. In this particular case, there is potential for possible, again, I've got to be very careful, possible linkage, but we can't be 100% certain on that, and that's why it's down as an unknown case.
Dr. Ewart, and the recent press conference was asked about the breakdown of positive tests on returning travellers. Part of the reason for not giving the information was data had to be done manually. The dashboard reports daily positive cases for returning travellers. Somehow this must be extracted from other positive cases, and this is probably already a manual task. A positive test on day 7 would not be reported as a new case if that same individual had already tested positive on day 1. Even if the data had to be extracted manually, it would not be a big task. The numbers are really low, and the dashboard only reports 8 cases since the 15th of February.
Well, it is actually a big task. Contact tracing has to go manually through every single case. That's one of the reasons why, if you remember, we had the big blow up about the data a couple of weeks ago, because where I had to caution and say there was only so many new cases, but the amount would increase because the contact tracing and everything else and the going through that data was still ongoing due to the sheer volume. So the only way really to pick it up in the first, because what contact tracing looks at is not whether that's that person's 7-day, 13-day, day 1 test. What they're looking at is, has that person already classed as being positive and isolated? And if there is a match with that person, they're not counted again in the data. So they're not necessarily breaking out and looking at interest in whether it's day 7, day 13. They're interested in what they have to do with that person. So at the moment, it's not recorded. I'm not saying we can't necessarily look to record that, but we do have to be aware it's a manual process. And, to be honest, we've been asking an awful lot of our teams on Ireland over the last 12 months. And while some statistics are great, and they're great from an information point of view, we really should only be capturing things and getting people to undertake tasks where it actually leads into decision making. So while there's a whole range of statistics, and I mean, I'm a project manager by trade, Paul. I love statistics, as you know from the many interviews you've done with me. I'd have statistics about everything. We just have to caution that really what we need is data that is actually going to prove useful in decision making, not nice to know stuff. So we just need to caution around that. But we can look, and we will look, to see if there is a way of actually extrapolating that and putting it up on the dashboard. And if there is, we will do it.
People just want to know everything, don't they? They want data on everything. Okay.
And like I said, the more data, the better.
Yeah.
But we just have to be conscious that particularly where it's manual tasks, if you're getting people to do manual processes, you're potentially taking them off doing other things.
Okay, a couple to go. You raise the patient transfer contract tender process in Keys on the 2nd of March. The document would be published, you were saying, by the end of March. However, this has not happened, according to this person. Loganair have the temporary contract until the end of May, so likely that will get a further extension whilst the government continue to flounder. I, together with my colleagues, have not had any wages from our employer, Stobart Air, for over a year, and this delay is adding to the anxieties felt by us, with no reassurance or closure on this.
Well, the thing we need to be careful of is trying to say one airline or another's going to win a tender. That tender processes, it depends, on the submissions at the time. We were hoping to have documentation out by the end of March. I believe that has slipped by a couple of weeks, but we are still determined to get the tender up and running. Like I say, the contract with Loganair runs to the end of May, as the person's correctly identified. But we have slipped by a couple of weeks, and that's purely down to the pressures of trying to do everything else.
And finally, could you ask about what steps have been taken to monitor the 336 children aged between 5 and 19 infected in the current outbreak for long COVID problems? Early detection and intervention is important.
Yeah, well, obviously people are obviously followed up by their GPs, etc. One of the interesting things, though, Paul, is in the UK that's had a lot more experience of this with long COVID. It appears long COVID doesn't really affect children. Now, at the moment, maybe that's one of these things that will change over time. But certainly, the evidence coming from the UK and other much bigger jurisdictions is that it only seems to be adults over the age of sort of 18 that tend to be hit with long COVID. It isn't prominent in children, or certainly at the current time. So I think that's quite an interesting thing to be looking at, and I'm sure there'll be a lot of studies around it. But anyone, children or adult, that is actually presenting with things they didn't have prior to COVID, their first protocol should be their GP to check that it is, because what we don't want as well is we do not want people dismissing things as being long COVID simply because they've had COVID and it actually turns out to be another condition. I am aware of someone who actually who'd been in touch with me who did just that, thought it was long COVID, but after me urging them to go to their GP and check anyway, they found it was actually a different condition that they were now suffering from, quite a serious one that they needed treatment for. So I would urge people, even if you've had COVID and things are different, your first port of call should be the GP to make sure that it's not something else, because we don't want people dismissing other diseases as being long COVID when they need treatment for something completely different.
Okay, well, thank you again for your time, and I keep getting amazed. We have so many questions coming in, so thank you to everyone that has written to us. I've tried to pick them up from the Twitter feeds and Facebook as well, but if you want to write, it's news@manx.net. It's probably the easiest one, and hopefully we'll return next week, David.
Yeah, and I'll see you virtually tomorrow at the press conference, Paul.